the Foundation for Professional Development is set to host one of the biggest health gatherings on the African continent. The 5th African Nursing Conference will be taking place this coming Tuesday and ending on Thursday. The conference is set to elevate the need for strategic investment in education and training while fostering a culture of advocacy-driven nursing practice to achieve the global commitment of universal health coverage. The two-day conference seeks to reinforce efforts in strengthening leadership within nursing. Joining us now to give us more details is Dr. Tracey De Klerk, who is conference chair of the 5th African Nursing Conference 2025. Doc, good afternoon. Thank you for your time. So a lot of words I was saying there, but break it down for us. You are at the coalface of this nursing conference, the African Nursing Conference. What is it about, and what are you seeking to achieve by hosting it?
Thank you so much to the C3 for this opportunity, and a very good afternoon to your viewers. Thank you for highlighting this conference by the Foundation for Professional Development. This is the 5th conference now that they are running, and over the past 2 years, they have had requests from the delegates to know more about either the private or the public sector. So the private wants to know more about public, and public wants to know more about private. And I think that is a great platform to start from, is to understand the different complexities in the healthcare delivery system. So we are really hoping that this is a platform where we can have a dialogue, where we can have collaboration, and really begin to understand where we currently are, and looking towards universal health coverage. And I think what I want to say to you, to Lesizwe, and to viewers is, you know, universal health coverage is something that every human being should be able to get basic health care. And there are sometimes, challenges that affect us. So we really want to get together. We want to be able to share best practices. We want to be able to learn from one another and take it from there. So that is a little bit about where it comes from, where it started, and what we are hoping to achieve with this.
Yeah. So tell me a bit more then how you intend to drive that conversation that places nursing as a profession at the heart of this whole goal of universal health coverage. Who are some of the people that you are attracting, and how have you framed some of the discussion themes?
Thank you. So I think the biggest thing is the way we have structured the program. It really cuts across private and public to share their insights, their daily practices. And it's not just about comparing them, it's about really understanding. And I think that's one point I want to highlight is when one engages with something different, it's important to really understand before one responds. And so it is about really understanding the different sectors. The public sector is extremely complex. And I'm saying this in my own private capacity, is that I was employed, I'm a product of public. I trained at BG Alexander Nursing College, and I went to work in private for almost 30 years. And I came back to public, and public is extremely complex. You know, when one comes into the field, you would think, oh, I'm going to do this and I'm going to change that. But when you really start looking at it and trying to understand the complexities, it just shows that we really need to enrich that dialogue. So we have got speakers from all, I think it's most private health institutions. We have got from public, we have got our principals, so MEC and DDG and HOD will be joining us. And it is an honor for us to have them. We are also having the military health services in, so that we are besides just understanding, is that we also want to energize that nurses can be catalysts and to drive the processes. You see, we've heard so much about NHI.
Yeah.
We've heard so much about universal health coverage, but it needs to come down to the level of the nurse. Because as nurses, we also need to know exactly what it's about and how and where we can actually fit together to serve the people.
Yeah.
And so therefore, we have got amazing people that are going to be breaking down what is universal health coverage about into the small components.
So from previous conferences, this being the 5th, are there themes, Doc, that have emerged just from the experiences of other countries about the resourcing, the stability and maturity of the nursing systems in various African countries? I mean, with reference, for example, with our own country, where we found out recently about the levels of resignations that we experience in the healthcare system. What are some of the themes that come out from other African countries that talk to resourcing, the maturity and stability of the nursing system?
Thank you. I think it's quite an intense area. And I think we know that generally there are shortages of nursing worldwide. And there can be many reasons for this, and there are many reasons. And I do know that, especially now that we have passed COVID and we've had all those the lockdowns, you know, I think nurses have also got to a stage where there's a lot of burnout and there's a lot of fatigue, and I often refer to an elastic band. And you can take a brand new, fresh elastic band and you can stretch that band. And it'll continue to stretch for quite some time until a particular time when it starts aging and it starts becoming quite brittle. And eventually that elastic band snaps. And, you know, it's easy to point at a nurse and say, but, you know, it's an attitudinal problem. And sometimes when you start digging down, it's about burnout. And I think nurses, and this is again my personal viewpoint, is that nurses are trying to find different ways of still nursing. So we are finding nurse entrepreneurs. I know there's a big drive in this, I think it's in the UK, in the States, it's one of those two, where they're talking to nurse, where you can provide private nursing.
Yeah.
And nurses are trying to open up their own districts and their own clinics, really, to move away from your typical hospital. So I think, you know, this platform is really there to equip nurses, first of all, looking at up-to-date practices. Secondly, it gives them a platform to also share their voices. And that together we need to have a look at moving forward and to see how we can possibly support nurses in the workplace. So wellness for nurses is another area that is going to be looked at in this two-day conference.
All right. Wish you all of the best with the hosting of the conference. That's Dr. Tracey De Klerk, who is conference chair for the 5th African Nursing Conference 2025. Just giving us a preview and foreshadowing what will be coming up from that particular front as far as that conference goes.